Hello and welcome back to my channel. So before starting the vlog for today, I would like to request those who are new to my channel and those who have yet not subscribed to my channel, please to subscribe it and also press the bell icon so that you get notified every time I put a new vlog on my channel. So today's topic of discussion, as you have already seen from the thumbnail, is the malaria. So let's start. So here I have written down some of the points so that we can easily sum up the things quickly. So first thing that one should know is that what is malaria and what is the reason behind it. So basically it is an infection which is caused by the Plasmodium species. There are about 100 species of Plasmodium, but out of which only 5 are infective for this malaria. Those are Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, and Plasmodium knowlesi. These 5 are single cell parasites. One should know that the erythrocytes have a special receptors for the Plasmodium vivax, that is called as Duffy antigen or the erythrocyte surface receptors. Okay, and these receptors are absent in the sickle cell anemia and thalassemia. We will discuss about it furtherly afterwards in some other video, but here firstly we will discuss about the life cycle of the Plasmodium parasites in the human, which is the asexual cycle, and in the mosquitoes, which is the sexual cycle. Okay, so first thing that we all know is that when a Plasmodium infected female Anopheles mosquito hunts for the blood, that means the Plasmodium infected female mosquito have the sporozoites, okay, inside the salivary gland. When that mosquito hunts for the blood, the human blood, that mosquito tucks the proboscis inside the skin of that human, the epidermis, or we can say the dermis, which has the blood vessel here. So the proboscis, when inserted inside the skin of the human, the sporozoites which we have seen and which we already know that the Plasmodium is in a stage of development called as sporozoite, okay, in the mosquito's salivary gland. So the parasites, or we can say the sporozoites, will enter inside the blood vessel, okay, that I have written here. The sporozoid spills into the blood stream. ठीक है, क्या होगा कि स्पोरोजॉइड जो है फिर ये ब्लड वेसल्स में आ जाएगा यहाँ पे, फिर through that it will go inside the liver. Here it will head towards the liver and get enlarged, and they will perform the asexual reproduction, that is called as सीज़ोगोनी. क्या होता है कि ब्लड वेसल्स के थ्रू जब ये लीवर में आ जाएगा स्पोरोजॉइड्स, ठीक है, जब ये लीवर में आ जाएंगे तो ये क्या करेंगे, ये डेवलप होने लगेंगे. दे विल स्टार्ट मेचुरेशन एंड दे विल अंडरगो द एसेक्सुअल रिप्रोडक्टिव साइकिल विच इज़ कॉल्ड एज सीज़ोगोनी. ठीक है, सीज़ोगोनी कहते हैं एसेक्सुअल रिप्रोडक्शन साइकिल को, विच इज़ टेकिंग प्लेस इनसाइड द ह्यूमन. What happens in this cycle is that the sporozoid will furtherly mature into the mesozoites. It will take about 1 to 2 weeks for this, and it will take place inside the Plasmodium species of falciparum, malariae, and knowlesi. What about the other one? The other one, that is the Plasmodium vivax and Plasmodium ovale, will form the hypnozoites. Hypnozoites do not divide further, and whenever they will form, they will take about over a month to about a year. Okay, and this phase is called as extra erythrocytic phase or the asymptomatic phase, because in this phase there is no symptoms which are seen. Okay, now we will discuss about the erythrocytic phase. So now we will discuss about the erythrocytic phase. What happens? The merozoites, which we have earlier seen, they, when released in the blood, they will bind with the RBCs. So the Plasmodium vivax will prefer to bind with the reticulocytes, the immature RBCs, and Plasmodium malariae and Plasmodium knowlesi will bind with the older RBCs. Okay, but the Plasmodium ovale and Plasmodium falciparum will bind with the erythrocytes in general. Okay, so now we will discuss that the erythrocytic phase, about 2 to 3 days, will form these particular stages like tropozoites, late tropozoites, and schizont. Okay, what happens? The tropozoite is a ring-like structure which will be formed. Okay, this is the first stage of the erythrocytic phase. Okay, after the merozoites enters the RBC. Okay, this is the first stage. The tropozoites are a ring-like structure which will be formed. Late tropozoite is the even more grown structure of the tropozoites, and the schizont, which is basically the replicated phase, in which mm, this schizont is formed by the consumption of the hemoglobin and the release of hemozoin. Now this schizont, this is H, this schizont will undergo the mitosis and they will form the merozoites. What happens? The merozoites will go inside the blood. Okay, there some of the merozoites will undergo the process of this gametogony, and they will form the gametes. Okay, they will form the gametes. Okay, this male and the female gametes. Okay, and these gametes will stay inside the RBCs. Okay, when a female Anopheles mosquito bites an infected human, when it feeds on the blood of an infected human, then what happens? These gametes which are present inside the RBCs, along with the RBCs, will be sucked by the Anopheles mosquito, the female Anopheles mosquito, and will go inside the gut. Okay, they will go inside the gut, and here they will get a bit more mature and they will form the zygote, and this is called as the sporogony. स्पोरोगोनी होगा, इसको हम लोग स्पोरोगोनी कहते हैं. दिस इज ऑल्सो कॉल्ड एज द सेक्शुअल रिप्रोडक्शन विच विल टेक इनसाइड द गट. Okay, what happens next is the zygote will form the ookinete and the oocytes that we will see. Now here you can see that the zygote which was formed will form the ookinete and they will form the oocyte, and now this oocyte, when go inside the mosquito gut, they will rupture and they will form the sporozoite again, and these sporozoite will travel to the mosquito's salivary gland, and this cycle continues. Okay, now we will discuss about the incubation period and the sign and symptoms. So here I have written down some of the sign and symptoms. Before that, I would like to tell you that malaria symptoms usually appears about 10 days to 1 month after the person was infected. So the incubation period can be about 10 days to 1 month. Okay, and the sign and symptoms that we will see are like in normal cases, fever, headache, fatigue यानी कि थकावट, डायरिया आपको लगेगा, nausea, vomiting. Also in some of the cases, metallic taste, retinal damage is also seen. So the specific species, that is the Plasmodium falciparum, these Plasmodium species, what they do is that they clump the RBCs, and because of that the RBC block the blood vessels, and because of which there is stoppage of the blood flow to the major organs. So when the blood flow is stopped to the brain, or we can say that there is some stoppage of the blood to the brain, we call it as cerebral malaria. Liver failure is the second thing, kidney failure. These all are the organ related. Means अगर ब्रेन को नहीं पहुँचेगा cerebral malaria हो सकता है, लीवर को नहीं पहुँचेगा तो लीवर फेलियर हो जाएगा, किडनी को नहीं पहुँचेगा तो किडनी फेलियर हो जाएगा. ठीक है, सीवियर डिहाइड्रेशन हो सकती है, शॉक होगा, एनीमिया होगा, बिकॉज रिपीटेड आरबीसीज जो रहती हैं वो रप्चर होती रहती हैं, तो बिकॉज ऑफ दैट एनीमिया होगा आपको. ठीक है, ब्लैक वाटर फीवर भी इसीलिए होगा बिकॉज बार बार आरबीसीज रप्चर होंगी, बिकॉज ऑफ विच द हीमोग्लोबिन विल बी कलेक्टेड, एंड ब्लैक वाटर फीवर आपको हो सकता है उसकी वजह से. ठीक है, नाउ वी विल डिस्कस अबाउट द डायग्नोसिस. So here I have written about the diagnosis. To confirm a malaria diagnosis, your provider will take a sample of your blood and send it to a lab. Okay, and to check for the malarial parasite, and the blood test will indicate whether or not you have malaria, and will also identify the type of the parasite that caused you that symptoms. So basically there will be a thick blood smear and a thin blood smear. The thick blood smear will locate the parasite sitting in the RBC, and the thin blood smear will tell you the Plasmodium species. Okay, the second thing which we can do is the rapid diagnostic test. Okay, now we will discuss about the treatments. The treatments will be discussed in the next video. Okay, that's it for this vlog. Thank you so much for watching my video, and please do subscribe to the channel. Thank you so much.